Hi, my name is Kennedy Raynor, and today I will be talking to you about the concept of obesity. More specifically, what obesity is, what causes obesity in adults, what problems can occur as a result of obesity, and how obesity can be treated or prevented. First, let's talk about what obesity really is. Obesity is a disease that occurs when the body has an excessive amount of body fat, which then causes a large number of other dangerous health risks. Weight is only one factor involved in determining if someone can be classified as obese or not. The main tool used to determine this is body mass index, or BMI. BMI is a person's weight divided by their height, which is then multiplied by 703. For adults, a healthy BMI is between 18.5 and 24.9. Therefore, if a person's BMI goes above 25, they will be considered overweight, and above 30 would be considered obese. BMI, however, should not be the only factor determining whether or not a person is obese. This is because a person, such as a muscular athlete, may have a high BMI but still be considered healthy because their body composition, which causes their muscles to add extra weight as opposed to their fat, is being used to determine their BMI. For this reason, obesity may be determined more by the amount of fat a person has and where that fat is located. Visceral fat, or upper body fat, is located around the organs of the abdominal area. This type of fat is most commonly associated with heart disease. Subcutaneous fat, or lower body fat, is found around the hips and thighs of people and is usually seen in women in their reproductive years. Obesity can also be determined using a person's waist circumference. Women with a waist circumference of 35 inches and men with a waist circumference of 40 inches have a higher risk of obesity-related diseases. While BMI and waist circumference are the easiest and arguably the most effective methods for determining whether or not a person is obese, healthcare professionals may use other methods, such as skin fold measures, air displacement plus mammography, hydrodensitometry, dual energy X-ray absorptiometry, and bioelectric impedance if they are in need of more information about a person's body composition. Now that you know a little more about what obesity is and how healthcare professionals determine obesity in adults, let's figure out what causes obesity in the first place. The first factor that goes into causing obesity is the body's natural functioning. Fat cells are arranged in adipose tissues, which are where fat is first stored in the body. As a person consumes more triglycerides, fat cells begin to increase in size and then in number. Obesity develops as adipose cells run out of space to carry more fat, causing the excess to go into other organs, such as the heart or the liver, which then increases the risk of chronic diseases. Adipose tissues also produce adipokines, which cause metabolic changes to occur in the body along with chronic inflammation. Obesity can also be caused due to the activity of an enzyme called Lipoprotein Lipase, or LPL. This enzyme takes triglycerides out of the bloodstream and into the adipose tissues and muscle cells for storage. This activity becomes much stronger the more obese a person becomes. Also, as obese people consume even small excesses in fat cells, their LPL activity becomes much stronger than in those of a normal fat status. LPL activity, along with the activity of other enzymes that break down fats, differs between men and women. This is because men in men, more LPL is produced in the abdominal area and the rate of fat breakdown tends to be higher. In women, however, more LPL is produced in the hips, thighs, and breasts, and the rate of fat breakdown is lower than in men. Genetics is another factor that has a role in causing obesity in a person. This is because genes interact with a person's diet and physical activity choices, which may predispose the body to obesity. There are also epigenetic factors that allow people to make choices as to whether or not they will eat specific foods or engage in specific physical activity, regardless of the weight conditions their genes determine for them. One protein that genes code for is leptin, which regulates how much food a person consumes. As body fat increases, leptin in the body also increases, which suppresses a person's appetite. As the body fat decreases, leptin decreases in the body as well, which increases a person's appetite, allowing them to consume more energy. If a person has the gene that causes a leptin deficiency, they may become obese due to a lack of appetite control. However, if a leptin deficiency is not the cause of someone's obesity, actions such as injections will do very little in fixing the obesity problem in that person. Another protein that genes code for is the protein ghrelin, which is secreted by the stomach cells to promote a person's desire for food in order to provide that person with more energy. When someone is releasing more energy than they are consuming, ghrelin levels in the body increase, whereas when a person is consuming more energy than they are releasing, ghrelin levels decrease. Now, let's get into the more external causes of obesity. Many people become obese due to environmental factors. One of these environmental factors is the idea of overeating. People who are obese or are likely to become obese tend to overeat more than people with a healthy weight and fat composition. This may be due to the genes that a person has that may cause their appetite to be abnormally high. However, society itself contributes to making overeating a lot easier. In American culture, unhealthy food items are regularly advertised and conveniently sold. The fast food industry, especially, is able to serve people excessive amounts of food that are high in fat, carbohydrates, and calories for exceptionally low prices. This leads people to believe that if they purchase unhealthy fast food items for low prices, they are benefiting more because of the higher amount of food. Purchasing food this way, however, causes people to eat more than 3 times the recommended serving size for each individual fast food item, such as fries, burgers, and sodas, which then can lead to obesity and obesity-related problems if the person chooses to eat this way often. There is also the issue of fast food facilities having very convenient locations and hours, which make people more motivated to purchase food items at these places instead of going out of their way to purchase healthier options from places like grocery stores or farmers markets. Obesity can also be caused by a person's lack of physical activity. This is because American society promotes the use of many forms of technology in order to make everyday tasks become achieved with less physical effort. Even though these technologies affect everyone, regardless of their weight status, people who are obese may be more inclined to use these technologies in conjunction with other conscious choices, which then prevent them from making physical activity a priority in their lives. People also tend to avoid physical activity more when they are distracted by television, video games, and computers. Using these devices keeps people content for long periods of time and inadvertently makes physical activity seem less appealing because of the energy exertion involved and the lack of easily accessible entertainment involved. The use of devices can also make people more prone to the influence of advertisements for unhealthy food items and habits. This is because these advertisements appear multiple times in one long sitting on a device and make unhealthy foods and behaviors seem more appealing despite the health risks they contribute to. Now that you know more about some of the causes of obesity biologically and environmentally, it is time to talk about the problems that are caused by obesity in adults. Heart disease is one of the most common effects of obesity. This is mainly due to central obesity, which negatively affects the blood vessels and the functioning of the heart. The more a person weighs, the more blood they have flowing through their body. This means that the heart has to work even harder to pump the blood through the body, which then causes high blood pressure. Also, when the heart has to work this hard, its muscles get thicker, which then makes it harder for them to contract and release properly. If the heart stays with this issue for an extended amount of time, it may not be able to keep up with its functioning anymore, and the risk of heart failure increases. As people consume foods that are high in sodium and cholesterol, their risk for other cardiovascular diseases, stroke, and heart attack also increases. These risks may also be elevated if there is a family history of similar heart-related health issues or a family history of obesity. Type 2 diabetes is another common health issue associated with obesity. In fact, the risk of developing type 2 diabetes increases as people gain more weight. This correlation exists because central body fat tends to be more insulin resistant than lower body fat cells, so people with central obesity are at a higher risk of developing type 2 diabetes. Insulin resistance is also caused because obesity causes the cells to have to process more nutrients than they can actually manage, and the stress of this then causes inflammation. This inflammation releases proteins called cytokines, which are used to block the signals of insulin receptors, which gradually causes insulin resistance and eventually type 2 diabetes. Like heart disease, people also have a higher risk for type 2 diabetes if they have a family history of type 2 diabetes or they have a family history of obesity, or both. Obesity is related to a disease called metabolic syndrome. Metabolic syndrome is a combination of different conditions in the body that together increase the risk a person has for heart disease, type 2 diabetes, and stroke. Obesity can cause metabolic syndrome because the increase of fat in the body causes the fat to collect in other parts of the body, such as the muscles and liver, once there is no longer room in the adipose tissues. This then causes the body's metabolism to change in ways that cause insulin resistance, decrease HDL levels, increase triglycerides in the body, and increase blood pressure. These changes together result in metabolic Syndrome, which increases the risk for diabetes, atherosclerosis, and hypertension. Obesity may also contribute indirectly to the risk of metabolic syndrome through insulin resistance. This is because obesity can cause insulin resistance in a person, which, along with type 2 diabetes, can also cause metabolic syndrome because insulin resistance also causes the metabolic disorder called impaired glucose intolerance, which can create metabolic syndrome. Obesity also contributes to the metabolic syndrome because when a person is obese, their adipocytes release products in abnormal amounts, and each of these products relate to a metabolic process in some way. So if they are not released in the correct amounts, the metabolic processes that these products are involved in become dysfunctional, which then can cause metabolic syndrome. Obesity also causes inflammation in many forms. Inflammation is usually a physiological response the body has in place to restore homeostasis. However, when a person is obese, inflammatory responses become too excessive. As more fat accumulates in the body, the more likely it is for adipokine proteins to be activated and contribute to inflammation. Obese people have liver tissues with an increased activation of enzymes that promote inflammatory cytokines to be produced, which then exacerbates cell receptor activation so that inflammation continues and metabolic pathways cannot be signaled properly. When inflammation is caused by obesity, adipocytes increase in size, which then causes the amount of adipose tissue in the body to increase, which then causes adipose cytokines to be produced more than they normally would be. This then triggers a series of inflammation-related physiological disorders. Immune cells can also contribute to inflammation in an obese person because as a person gains more weight, they produce more immune cells that contribute to inflammation in adipose tissues. The increase in blood lipids also contributes to inflammation in the body. Although scientists haven't figured out exactly how, obesity may contribute to the risk of some types of cancer. This may be due to the increase in hormones that comes with the increase in weight, which then influences the likelihood of developing cancer. There also may be a relationship between cancer and obesity because fat cells produce the adipokine leptin, which promotes cell growth and increases body fat in the blood, and the adipokine adiponectin, which may inhibit cell growth. Adiponectin is not abundant in obese people, so cell growth can't be stopped as easily, so cancer may come as a consequence. Because obesity can cause different types of inflammation, it can cause diseases such as gallstones, which is a strong risk factor for gallbladder cancer, along with chronic ulcerative colitis and hepatitis, which are both risk factors for different types of liver cancers. Obesity can also contribute to the risk of developing other cancers, such as kidney cancer, pancreatic cancer, breast cancer, and many other types of cancer. Some other problems that may result from obesity include sleep apnea, osteoarthritis, gallbladder disease, kidney stones, respiratory problems, infertility, and complications during pregnancy and surgery. Now that we have talked about obesity and some of the factors related to its cause and effects, it's time to talk about ways to medically treat obesity. First, let's determine who in the category of obesity requires medical intervention. Those who are classified as obese based on BMI or waist circumference alone but show no other risk of obesity related diseases might not need to lose weight as urgently. However, people in this category should still focus more on not gaining much more weight in order to prevent health risks from arising. Those who are of obese BMI and waist circumference and also exhibit signs of obesity related diseases need to be more concerned about losing an amount of weight recommended by their physician and making different choices in terms of diet and exercise. It is also important to remember that the more life threatening a person's obesity becomes in terms of their health, the more intense actions need to be taken to reduce their weight. Because obesity is considered a chronic disease, drugs can be used at some capacity to help those suffering from obesity and life-threatening effects of obesity. These drugs, however, need to be prescribed by physicians very carefully in order to make sure they are effective for the individual and don't cause dangerous side effects. One of the drugs used to help with obesity complications is orlistat. Orlistat is usually prescribed by physicians if a person is obese and has obesity related diseases such as type 2 diabetes, hypertension, or hyperlipidemia. This drug is used to inhibit the activity of pancreatic lipase in the GI tract in order to keep 25% of the fat consumed by a person in a meal from being digested and absorbed. Orlistat works best only if a person consumes 30% of their daily calories from fat and engages in some type of daily physical activity. Another group of drugs usually prescribed to help people lose weight are phentermine, diethylpropion, and phendimetrazine. These drugs suppress a person's appetite by enhancing the release of a neurotransmitter called norepinephrine. These are all short-term medications which are prescribed by a physician in conjunction with weight loss behavioral changes and a specific low-calorie weight loss diet. It is also important to note that these three drugs are used more as a preventative measure against some obesity-related diseases and should usually not be used if a person has or is already being treated for diseases such as diabetes or other serious cardiac abnormalities. Surgery is another method that physicians use in order to improve the condition of people with clinically severe obesity. Surgery is an appealing option for people with high levels of obesity because, although proper diet and exercise are helpful, their effects occur too slowly for people who need immediate intervention with their obesity. Like with drugs, surgeries require the person to also comply with specific dietary plans after the surgery has been completed. There are two main types of surgeries used to help with obesity, both of which decrease a person's food intake by reducing the stomach's capacity. One type of surgery is gastric banding surgery. In this surgery, a band is placed around the opening between the esophagus and the stomach in order to alter the size of the opening using a port placed in the abdomen just beneath the skin to inflate or deflate the band. This surgery makes sure that the stomach is only able to handle a certain amount of food at once. Another type of surgery is gastric bypass surgery. In this surgery, a small stomach pouch is constructed with an outlet that brings food directly to the end of the small intestine without having to go through the stomach or most of the small intestine. This surgery reduces the body's production of gastrointestinal hormones, which then causes hunger suppression. These and other surgeries are intended to help with weight loss and are able to improve the conditions caused by insulin resistance and high blood pressure.